love in the simplest way. Um, Beauty is literally in the eye of the beholder, and to me, it's heavily rooted in love and gratitude. That's all beauty is.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Britt Brooks-Dantley, a licensed marriage and family therapist. She is certified in clinical trauma, and she is an approved clinical supervisor through the American Association of Marriage and Family Therapists. Her expertise is learning and understanding the true impact of generational trauma and how to interrupt the patterns to accept and embrace your true self through healing and grief. So Dr. Britt, welcome and glad to have you here.
Thank you for having me.
Yes, let's start from the very beginning. How did you first get interested in the medical field? We'll kind of go broad, the medical field.
You know, to go all the way back, it was not my first choice. It wasn't until I went to my first graduate program in Tampa, Florida at Argosy University, where I got into human services with the focus on counseling. And in the process of learning about counseling and understanding the needs in human services and how to join with people and the purpose of it all, I really started to fall in love with the field. And that is literally the catalyst to me coming to the field of mental health.
Okay, got it. And now you're part of Ember Psychotherapy Group. Tell me a little bit about that practice.
Yes. So I am the owner and founder of Ember Psychotherapy Group. We were founded this year, so it's brand new, and we already
Congratulations.
thank you so much. We already have people starting. Actually, we just had 2 people start this week, and we will continue to have new entries throughout the course of the remainder of the year. Our practice is solely rooted and poured into the clinicians so the clinicians can pour into the world. I believe in providing a lot of education because I am also a professor at Columbia Southern University, where I teach in both the counseling and psychology departments. So I am heavily into educating clinicians, making sure that I am supervising them from different lenses that are most appropriate and aligned with what they want to do clinically. And I am a true believer of creating competent and confident clinicians.
Okay. And what led you to decide to start this business?
You know what? I started in private practice in 2022. And before that, I was in community behavioral health. I was in the school setting. I even worked at a retirement home. But working in private practice, I really started to learn the intricate details on how to run the business, because once I started moving up and started getting higher positions at that practice and moving my way all the way up to chief operations officer. And from there, I learned so much. And I'm like, oh, I can do that. And I can do it in a way that I think is best fitting for the clinicians that I most work with.
Okay. And now that you have this practice, I want to talk about some of the treatments that you provide in the therapy that you focus on. And I want to start with the emotional focus therapy. Can you tell me what is emotional focus therapy?
So EFT is a systemic modality that is heavily aligned in the discipline of marriage and family therapy. Granted, you can also see it in the counseling discipline as well, but it's heavily rooted in identifying attachments and the underlying emotions that one may be feeling and or avoiding. So getting back rooted in understanding where those attachments, historical attachments, emotional attachments began, and really understanding the layers underneath with the emotions that may be at the root of everything.
Okay. And then you also do solution-focused brief therapy. What is that, and how is it different from the emotional side? I'm thinking like solution-focused. Well, isn't all therapy should be solution-focused? But I guess I'm missing something.
No, to your point, all types of therapy should come to some type of resolve, depending on if that's what the client is desiring, the client or the patient is desiring. But solution focus is mainly a modality. Once again, it's in the discipline of marriage and family therapy, and we are focusing on creating your desired outcome and helping the client navigate those steps towards reaching those desired outcomes. So it has a lot of different tools and skills. Mainly the big question is like the miracle question. If everything could be great, what would your life look like, right? So really identifying the end goal to then create the steps to get there and navigating from first order of change to second order of change to really install like those interrupting patterns to
Mhm.
get to new behaviors.
Okay, so I would imagine that some of these therapies would overlap, at least I guess some of the psychologies, or are they kind of really specifically individualized or only going to work best in a certain situation?
Absolutely. So, in my opinion, different modalities would work differently with different people. It's not a one size fit all.
Mhm.
Everyone is not at the point where they can explore emotion focused therapy when they're starting out at therapy. Some
Mhm.
clients and patients, they can come right in and join with the clinician and work on those attachments, and some we will need a slower burn, as I like to identify it,
Mhm.
really exploring other things that even brought them into therapy so that they can start building a rapport with their clinician and really start to make those smaller changes to get to the deeper things that they want to address.
Got it.
So it's
And
not a one
then,
size fit all, so it's a
yeah, so you
lot
got to
of
find the
different
one.
modalities that work to help different behaviors.
Okay. Now, there's also the Bowen family therapy. What
Yes.
is that?
Okay, so with Bowen, a huge component of that is really looking at the generations, like the multi-generational family.
Mhm.
Um, this can be the traumas, behaviors, messages, all of that. Big tools that are used in Bowen family therapy is the genogram, and this is where you'll join with your client and or clients and really identify those family members that they have and identify like different behaviors that they all share. We're pointing out who struggles with what, um, different life trajectory things that has happened, divorces, marriages, children. We're really mapping out the entire family to see the repetition of behaviors or the intergenerational traumas that may be passed down or messages that may be passed down so that we can start interrupting those.
Okay. So with the multi-generational trauma, I want to define that a little bit more. Is it something that it's more along the lines of, let's say that a grandfather had depression, so then the father and then the son and then maybe even their son might have depression, like kind of runs in the family? Or is it more of well, the grandfather was abusive and then the father was abusive and then the son becomes abusive because that's kind of what they grew up in? Or I guess is it both?
It's both.
Mm.
It's both.
Mhm.
Um, because to the examples that you've already identified, you can have a grandfather who struggles with depression and the behaviors that he shown his family throughout those years of the struggling with depression. Everyone's watching that. So naturally, because there are some diagnoses that are DNA inherited,
Mhm.
that's what goes into my next modality that we're going to talk about as well. But behaviors, um, biology, all of that is all generational.
Mm. Okay, got it. And then finally, another therapy method I want to go into was the bio psychosocial model.
Yes,
What is that, and what situations does it apply to?
absolutely. So, from my perspective, this is actually a modality that I used in my dissertation when I was obtaining my doctorate degree. I really want to understand how generational trauma of depression showed up in Black women, right? So going back generations of one individual and really understand so we can start with the psychological, like what were those messages that were passed along at home? Like, oh, in order to be a woman, you must be at home. You must do this. You must do that. You have to have certain characteristics to be quote unquote identified as a strong woman in a sense. We're looking at the biological aspect. Like, did mom suffer from depression? Did grandma struggle with anxiety? Did great grandma struggle with addiction? We have to look at all of those intricate layers throughout the generations of that individual's family. And then we have the social component too, like what are those messages from society that has been passed down, even within the home? That is another aspect that is also included in that, to really understand what this individual that is in front of you is dealing with and has been dealing with, so that we can start rewiring and creating new messages. That's narrative therapy, so that they can interrupt all of that past trauma to recreate a new story.
Wow. Okay. Now, Dr. Britt, I'm sure that throughout your experience, you've heard a lot of misconceptions or myths from your clients and your patients. What would you say are some of the most common myths or misconceptions you've heard?
Hmm, there are so many. One huge myth is that men don't go to therapy.
Mm,
I hear it all of the time. Actually, the male clients that I've received and that I do give to other clinicians that I supervise, that is a heavily repeated message that they come in to therapy with. Men don't get therapy. Men don't need therapy,
mm,
and obviously that isn't the truth. Um, Another myth is that there's so many. I'm just trying to pick one. Um, Therapy isn't helpful.
mm.
You know, Therapy is a collaborative method to improve behavior. So if you're just showing up to therapy and the therapist is doing all the work, or the only time you're actually actively listening and really taking things in, it's the only time you're doing that is in therapy, guess what? It won't work because you're not collaborating outside of therapy. It's a collaborative approach.
Okay. And I'm sure that you've gotten people that come in and say, "Oh, my spouse, my parent, my son, my daughter, my friend told me I need therapy, but I think I'm fine." How do you deal with a situation like that?
Absolutely. You know, I would first join with that client and identify how do they feel when they hear those repeated messages from everyone around them,
Mm,
because I want to know what they're internalizing from hearing that.
mm,
And I want to know how they're conceptualizing the purpose of therapy,
mm,
because you can be fine and still
mm,
go to therapy,
mm.
to have a space to process and to unpack and to get a different perspective that will broaden how you're viewing self and the world around you.
Okay. So basically what you're saying is that even if someone doesn't maybe show the typical symptoms of trauma or anxiety or whatever it is, even if they're mentally sound, they can still benefit from therapy.
Absolutely.
Okay. So what about the people kind of on the fence where it's like, well, I think I'm okay, but I just kind of want to see if there's anything that I'm just not realizing. What would be some of the telltale signs of maybe trauma or something manifesting in their life, um, where they think that, hey, you know what, I think therapy can really help me.
The telltale signs when they're coming into therapy and they don't have the bigger diagnoses or struggles
Yeah, so I guess
that are more
it's some
obvious.
yeah, so I guess if someone comes in like, oh well, I had an abusive parent, well, okay, you probably need therapy. But what if it's like, well, I had a pretty decent childhood. Yeah, there were some maybe rough things here and there, but I don't think it affected me. But is it kind of manifesting another way? Like they're having trouble sleeping, or they have trouble with maybe romantic relationships, or like I guess what like those kind of telltale signs that, hey, you know what, maybe there's something that we can try and unearth through therapy.
Absolutely. I truly believe, and this is a message that I want to clearly get out,
Mm,
there doesn't have to be something wrong to
mm,
come to therapy,
mm,
right? And yes, different experiences can manifest behaviorally or even physically if unaddressed. But it would really take the clinician to join with that client to truly understand their experiences and to help the client make those connections.
Okay. Now, let's say that somebody is looking for a therapist. They've never done it before. They're not sure where to start. What advice would you give to this person as they're doing their search so they can find that therapist who has the knowledge, has the experience that they can resonate with and trust, and who can help them basically work out through kind of their issues and get them to the other end of it?
Mm-hmm. That's actually a great point. So there are several different avenues that one can take when searching for a therapist or a clinician of some sort. One, I always recommend Psychology Today. That is a virtual platform that you can go to and really filter it to meet the needs that you do have. Another option is to, if you have insurance, to look on the back of your insurance card and to research who is in network, what clinician is in network. And then from there, going to their personal website or finding them on Psychology Today to really read that bio to see if what this clinician is putting in their bio is reaching out to you, if this is something that you see yourself in, and then reaching out to them because they provide that contact information as well. But there are a plethora of mental health platforms to find providers.
Okay. And I'm sure that also, Dr. Britt, throughout your experience, you've run into maybe some challenging cases or memorable cases. Is there maybe one story that comes to mind that you're able to share of just one of those cases and how you were able to help them get a successful outcome in the end?
I won't speak about a specific case, but what I will say is that um, my hardest cases are usually the ones that involve a lot of childhood trauma
Mhm.
and helping that client navigate through what they have experienced, what they have been avoiding, giving them the language to use to name what they're internalizing, what they're feeling, what they have been repressing, and to create this space where they feel safe to just sit in it and to then give them the tools so that they can start applying it to their everyday life of what we just work on in therapy so that they too can collaborate with me in their treatment to get to the desired outcome.
Okay. And when it comes to the future, where do you think the future of mental health is going?
I definitely see it continuing to evolve in a positive trajectory. Um, to be quite honest, prior to the pandemic, therapy was a thing, right? But it's like once the pandemic happened, I've seen an increase of people accepting therapy, wanting therapy, desiring therapy, needing therapy. And I've also seen an increase in people wanting to go into therapy to become a clinician.
Mm-hmm. Okay. And with the future in mind, also, what's the vision you have for your practice?
For my practice, I would love to continue evolving and really training clinicians to continue growing in their career, whatever direction that they want to go in, being able to provide them the support that they need to reach their goals and giving them nuggets of encouragement along the way so they can continue to grow their confidence in what they're able to do. I tell anyone that I supervise or mentor, like, the sky is not even the limit for what you can do if you just believe that you can.
Very well said. Well,
Okay.
Dr. Britt, I do have one last question for you, but before I ask it, I do want to point people to your website at emberpsychgroup.com. Now, last question for you. What
Yes.
does beauty mean to you?
Love in the simplest way. Um, Beauty is literally in the eye of the beholder, and to me, it's heavily rooted in love and gratitude. That's all beauty is. and
Okay.
how you are seeing that through your lens.
Okay. Well, there you have it. Dr. Britt sharing her expertise. So, Dr. Britt, where can people contact you and your practice?
Absolutely. As you have already stated, Daniel, you can find us at www.embersightgroup.com. You can reach me directly at Dr. Britt. That's all connected. It's Dr. Britt at embersightgroup.com.
Awesome. Well, Dr. Britt, this is great. Thank you for coming on, and thank you for
Thank
sharing your
you.
message.
Thank you so much for having me. It's been a wonderful time chatting with you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.